I always wanted to be a doctor. I remember when I was really little, writing in my scribbler, I want to be a doctor. I don't want to be a dentist. So my path was really quite clear, but wasn't quite so clear was what kind of a doctor I was going to be. And it really wasn't until well into my medical training that I started hearing about geriatric medicine, and that came to my attention. It really wasn't on my radar at all. At the same time, I was starting to get interested in the health of older people through the experiences of my own grandparents. My grandfather lived to almost 103, and my grandmother lived well into her 90s. But I started to appreciate that not all older people lived such active and long lives as they did. In fact, there was a major gap in care for older adults, and that gap was made worse by a lack of research. So this equity gap inspired me to pursue a career in geriatric medicine, in research, focusing on older women. Now, this issue is probably more important now than it's ever been. We're about to be what's called a super age society, whereby 20% of our population will be aged 65 years of age or older. And at the same time, the younger population is decreasing in age. So those under the age of 14 now represent about 16% of the population. Despite this, we have 304 geriatricians for all of Canada, which means about 1 for every 20,000 older individuals. And in contrast, we have about 9 times as many pediatricians. This health gap disproportionately impacts older women because older women make up the majority of the older age group. And that majority increases with age, so by the time we get to centenarians, about 80% of them are women. And in fact, we have more than 10,000 centenarians in Canada today. So that means that women are really the invisible majority in healthcare, and they're really flying under the radar. Let's look at some of the environmental factors that are unique to older women. Most older women are living in the community. They're very politically, socially engaged. They're very independent. But women have unique challenges. So women are more likely to be caregivers. They're more likely to live alone because perhaps they've outlived a spouse. And that may mean when they need caregiving, they may not have somebody there to give them that care. And that accounts for the fact that women are the vast majority of people in long-term care homes. Let's look at some of the unique health needs of older women. Women live with multiple chronic medical conditions. They also use medications that are likely or can be inappropriate for them. For example, sleeping pills that leave them drowsy in the morning and put their driving at risk. Yet despite this, women are the invisible majority in health research. So let's talk about some of the good news. At Women's College, we're home to one of the only research hospitals with a focus on health of women. And we're leading the world's efforts to understand some of the unique needs of older women. And we're doing this by advancing equity-based care through equity-focused research. Let's talk specifically about some of the things we're doing. So one of the things we're doing is making sure we incorporate sex and gender in all the research that we do. This is important because until the 1990s, women were not routinely required to be included in clinical research. Even, maybe more shocking perhaps is that until last year, older people weren't required to be routinely included in clinical research studies. And as a result, a lot of the treatments that we have currently for older women are likely not really suitable for them. And at Women's, we require all of our researchers to put a sex and gender lens in the work that they're doing. We also do drug research. Early on in my career, I noted that many of the pills that I would be prescribing for older women were being split. And I found out that that was because the lower dose that was really more appropriate for older women wasn't manufactured. And that's a direct result of older women not being part of the research. So at Women's, we study how medications impact women differently. We're also looking at something called prescribing cascades and how they impact women. This is where you get a drug, you develop a side effect, and get another drug to treat those side effects, and it continues on. We're working with international leaders from 6 different countries and finding ways to prevent this problem from happening. And our research results have the potential to inform deprescribing internationally. When I started out in this area, there was relatively little research in geriatric medicine. And now I'm proud to say that Women's is really leading the efforts globally to improve the lives of older people, and particularly older women. And I just want to stress that this is very important because, like it or not, we're all aging. So let's talk about what you can do. So there's a few things. So one is to be aware of health conditions that are particularly important for women, like heart health, and remembering that heart disease is the leading cause of death for women, and thinking of brain health, and remembering that dementia impacts twice as many women as men. Talk to your providers about these conditions and others that are important for women. It's also important that we all take care of ourselves. So think about your diet, think about exercise, think about being socially engaged. These are all things that are really important for promoting your health and well-being as you age. And perhaps most important, ask what research is being done about older people, and in particular older women, and push for more. So as we continue to ask questions and seek answers, it's really my hope that one day older women will no longer be invisible, and that the care that we provide will be tailored to the needs of every individual, and health equity will be enjoyed by all. Thank you.